Hello everybody, welcome to my vlog. And for the subjects I'm going to cover over the next few weeks, you might think that they're quite simple subjects, and they are, but they really do affect people's lives. So there are two reasons that I'm doing them. One, because they affect people's lives and I see them in GP all of the time, and there are some simple ways to handle them. And the other is because I don't know if you know, but I'm expecting a baby within about the next week. So I need to actually get some vlogs done today that allow me to do that and not feel too uncomfortable as I sit here with my bump, and buy me a little bit of breathing time while I settle new baby into this vlog life. So that's what's going to happen over the next few weeks. So the first one that we're going to cover today is ingrowing toenails. Now, as I said, it might sound simple, but it isn't quite so simple, and it really is painful. So firstly, what is an ingrowing toenail? So an ingrown toenail is where the sides of a nail, a toenail usually, grow into the surrounding skin. And this happens when the nail curls over and it pierces the skin, and then it continues to grow. And as it grows, it damages the skin. And the skin becomes swollen and red and often very painful indeed. It's often the big toe, that's the most commonest site, but quite often on both sides. So it really does affect everything you do, because the big toe is really important in walking and balance. So what are the symptoms? Well, as I said, inflammation, that redness and swelling at the end of the toes and the sides of the toes where the nail is actually pushing into the skin. Pain on walking, any kind of walking, and on applying pressure, so most shoes will hurt. You get a build-up of fluid around the toe, and then an overgrowth of skin which is quite boggy and soft around the injury area. And then this boggy skin starts to bleed and ooze, and then you get pus as it gets infected from that area. And then sometimes that infection starts to spread, so the redness spreads further and further away from the toe. So what are the causes of ingrown toenails? Well, the first and most common cause is very tight or poorly fitting shoes that are narrow at the end, tight socks, tight tights even. And this forces the skin onto the nail, and that then allows it to cause an injury, and then it's just a vicious circle from there. Badly cut toenails can be a cause. Now what I mean by that is if they're too short, or if you curve around the edges of your toenails at either side, that allows the skin to grow over the nail, and the nail then grows into the skin and the problem starts. Injury to a toe can cause an ingrown toenail. Sweaty feet, because this keeps the skin very soft around the nail, which then allows it to push into the skin much easier than if the skin were as hard as it should be. Your natural nail shape, believe it or not, can make you more prone. So if you've got naturally curved or fan-shaped nails where the edges are more likely to press into the skin, this can cause them. And fungal nail infections, and we are going to talk about those on another vlog, can also cause it, because it causes the nail to thicken, widen and lift and then dig into the skin. So those are the causes. So when should you see your GP? Well, on this occasion I'm going to say that if your nails are badly inflamed, you have pus and bleeding, you will need to see your GP. Or if you have diabetes and you have an ingrown toenail, don't sit with it, because you're more at risk of complications, so see your GP. So what treatments are there? Well, in the acute phase, where you're infected, that's the first treatment that your GP can help with. There is self-help, and there is surgery further down the line. So when the nail is initially infected and you've got that blood and that pus and that oozing toe that's too painful to wear anything but flip-flops, and I usually see patients wearing flip-flops when they come in with this, you will need antibiotics. We need to get rid of that infection before we do anything else. So sometimes if it's not too bad, your GP will give you a topical antibiotic like Fusidin to actually just put on the skin. But if it's quite bad and there's redness spreading away from the toe, so you're at risk of cellulitis, your GP will give you tablets, antibiotics to take. So if you're not allergic to penicillin, that will be something like flucloxacillin, and if you are, something like clarithromycin. So assuming it hasn't got this bad, or you're prone to them and you don't want another one to come, what are the self-help things that you can do? Well, hygiene is really important, so keeping your feet clean can prevent infection from embedding. using soap and water all of the time, and trying to make sure that they're not too sweaty, which I know is really, really hard, but it's something that you need to think about. Changing your socks and tights regularly, daily. Gently pushing the skin away from the nail using a cotton bud, so nothing hard, something soft. And you can prepare your toes for this by soaking them in water first so that the skin is quite soft, and then just using that cotton bud to push the skin away. Cutting your toenails straight across is really important, and I'll put a link at the end for the ideal way to have your toenails to avoid ingrown toenails. So straight across, not curved at the edges. So yes, you will have that sharp bit because you're cutting straight across, but they're less likely to dig in. And make sure you get comfortable, very wide fitting and well fitting shoes. So what if it's not working and you're doing all of this and you're having regular antibiotics and you want a permanent solution? So surgery is probably the answer. So there are two different types of surgery, and this is minor surgery. It's done under a local anaesthetic, and it will be done by most GPs in a minor surgery clinic that they either refer you to or they have in their surgery already. So the first one is called a partial nail avulsion, and this is quite an effective treatment, and it's, as I said, local anaesthetic, and then just either side of the nail, a 2 to 3 millimetre strip of nail is cut away and taken out completely. So you have two gaps either side where there's no nail touching the side skin. They apply something on the skin afterwards that they've exposed called phenol, and that's to stop the nail from growing back in that area. You don't need a nail in that area, and yes, it looks a little bit different, but eventually it will all heal over and just look like the rest of your toe. So that's one surgery. The other is total nail avulsion, and it is exactly what it sounds like. If the nail is really thickened and we think that cutting down the edges is not going to work, then the whole toenail gets removed. And it's absolutely safe to not have a toenail, and the skin will harden, and yes, it will look very different to your other toenails, but it does work. So those are the two surgeries, and after those surgeries you'll have some sterile bandaging over your toe. You'll need to rest for 2 to 3 days, elevate the foot to keep the fluid from running away, painkillers, and open toe shoes, so flip-flops, sandals, for a few days afterwards to just protect the area and obviously keep the pain away. So are there alternative treatments to the one I just told you? Well, having a look around, there does seem to be a brace. It's a nail brace that people say works as well as having surgery, and they get very good results at 1 month, 3 months and 6 months. It's especially good if you've got chronically ingrowing toenails. So I'm going to put some links to that afterwards so that you can have a look. I don't know if it's available on the NHS or from podiatry on the NHS because it's not something that's that long-standing, and it's not something that I've heard about as a GP. But there does seem to be some evidence out there for it. So in summary, ingrowing toenails, there's lots of self-help advice, and I'll put some links to that afterwards for you. If it's looking infected, so red, swollen, pus, bleeding, please see your GP. You might need antibiotics. Remember that nail cutting is critical, and it's really important to cut straight across, not curving in at the edges. And losing a nail through surgery is not damaging long term if it's necessary, and sometimes it is necessary, I'm afraid. You need to get rid of that offending toenail. And you must seek urgent medical help if you're diabetic. That's really important because of the risks that you have as a person with diabetes. So, hopefully that's been really useful. I'll put some links in afterwards to the NHS pages on how to care for an ingrown toenail and what advice they give. I'll put a link to how to cut your toenails to avoid them, and any other useful information I can find about the brace. I hope it's helped, and as ever, thank you so much for watching. I will keep you updated on little one, obviously, and see you soon. And don't forget to ask me for any topics you want in the comments afterwards, or any questions that you have about this, and I will always answer them. Okay, bye for now.